Testing. Testing, 1, 2, 3. Are you going to leave the mic here? Okay. Oh, okay. Testing, 1, 2, 3, testing. Great, okay.
Mic check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do you guys have sound?
Hello, do you guys have sound?
Mic check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
There's a little delay for that.
Okay. Please mute your phones, if you would, please.
Are you hearing them talk to you? Are you getting audio from them? They're doing a mic check right now.
Mic check, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, you're good.
All right, thank you. Good afternoon. Just want to give our news media, our television media a 30-second warning, 30-second heads up, and then we will begin our news conference. Thank you. Good afternoon. My name is Chris Osborne, Public Relations Manager for the Jefferson County Department of Health. Today, Dr. Mark Wilson will come to the podium and give us an update on the COVID-19 situation. Dr. Mark Wilson.
Good afternoon. My name is Mark Wilson. I'm the County Health Officer for Jefferson County. Over the past week, we've issued recommendations. We've also issued our first public health order, and the State Health Officer has issued similar orders. But as cases have continued to increase in Jefferson County, we must take additional bold action to slow the spread of COVID-19. I'm now issuing a new order which replaces my previous one. This order is being placed on the Jefferson County Department of Health Facebook page, and it will be circulated broadly for everyone to see all of the details. So I'm not going to go through all those details right now, but tell you the purpose of this new order and the emphasis that we're placing things on. We are seeking to eliminate all non-essential activities and services which put people at increased risk of spreading disease. We are trying to protect those essential services that are essential for health, for safety, and for sustenance of life. And we also want to make sure that the orders are designed to protect those people that are on the front lines of protecting the rest of the community, our healthcare workers, our public health workers, and our first responders. So as the COVID-19 pandemic continues, we're seeing increased numbers of deaths around the globe. We know that COVID-19 is deadly to a large portion of the population. And I know that each day and each action either results in lives lost or lives saved. And today, I'm taking another step to protect and defend the lives of every person in Jefferson County. These public health orders are meant to save lives by limiting the spread of the virus. But what I'm doing today is only part of the solution. Today, as I stand before you, I ask that you carefully consider the people with whom you come in contact. Think of your mother, your father, your grandmother, your grandfather, your aunt, your uncle, your daughter, your son, and everyone else you meet each day. Furthermore, people you meet each day and come into contact with will also contact so many more people. And in that chain of interactions, you will touch the life of someone who is more vulnerable to COVID-19. Jefferson County, the state of Alabama, and the United States as a whole has not been called upon to wrestle with a problem of this magnitude since World War II. In that dangerous and uncertain time, the greatest generation banded together to work toward a common goal, and that is precisely what we must do now. Our enemy is one that we cannot see with our naked eyes, but we can clearly see the devastation that this virus has left in its wake around the world. Now is the time to do our part, to work together and to overcome this threat. Finally, I want to leave you all with a word about where my heart is on this matter. My heart breaks for the people of Jefferson County and for the people across Alabama. I understand that what I'm asking for is one of the greatest sacrifices we've ever had to make as a community. I understand that these orders impact people's lives in untold ways, and I wholeheartedly believe that some suffering now will prevent untold pain and suffering in the months to come if we do not take these extraordinary steps. Now I'm going to introduce to you Jefferson County Commission President Jimmy Stevens.
Thank you. Ladies and gentlemen, we are indeed at war. Probably the greatest foe that we have faced since World War II is amongst us and in our community. It's going to take a concerted effort of everyone working together to defeat this foe. Now, I stand here before you representing the elected officials. Everyone has been in constant contact and are working together to make sure that all of these damages are mitigated and that we do have a pathway to the end of this pandemic. It's going to require a commitment by you to heed these words of Dr. Wilson and to follow those to make sure that this tremendous calamity does not spread. I would like to end with some words from World War II, Sir Winston Churchill. I have nothing to offer but blood, toil, tears, and sweat. Victory at all cost. Victory in spite of all terror. Victory, however long and hard the road may be, for without victory, there is no survival. We must remember that, and we must be committed. God bless each and every one of you, and let's work together to end this virus. Thank you.
My name is Wanda Hurd. I'm Public Relations Coordinator here with the Jefferson County Department of Health, and we will now take questions from the media. I'm going to go by the roll call and call your name, and you can ask your question. And please be mindful to keep your phones muted if you're not asking a question. Corey with CBS 42.
Yeah, my first question is about hospitals, medical supplies, urging patients with mild symptoms to stay at home. How is the county just really prepared to protect healthcare workers when even the CDC recommends to use a scarf as a bandana as a last resort if supplies run out? There's a huge fear around the country now of running out of beds, ventilators, and masks. And I guess it's kind of a two-parter, but even what are the elderly people are supposed to do?
So I understand the question is about supplies, protective equipment for hospital workers. Is that correct?
Correct.
Okay. Yeah, this is really an important issue, and we are concerned about that. The federal government is trying to help us. There are other supplies that may be mobilized that we can eventually get into our community. But I will say, though, that we do have to use every resource that we can find to make sure we have that protective equipment that we need. The face masks, the gowns, the gloves. So we are going to be looking for other local assets. And one thing we're wanting to do is ask our local private doctor's offices and others that have this equipment in stock, perhaps that they're not using, and maybe they are not seeing these types of patients. We're going to be asking them, and I will ask them now, to voluntarily provide us with some of those. Thank you.
Next question from Alan with Channel 13.
Yeah, real quick, the funerals and other events like that, how will they be, or who will make a determination whether or not those are allowed?
Yes, this new order actually is consistent with the White House recommendations of no more than 10 people gathered in a space. So that is still going to have to be followed, and the recommendations to maintain the 6-foot distance from each other is going to need to be followed. So funeral homes are going to have to be careful how they do that, and there are going to be some limitations in how they conduct their services.
Yes, it's WBRC 6 on the line. Do you have a question?
We do. We've got a couple. Our first is, do the rulings today include grocery stores? Would be a first, and if so, I've got a follow-up to that.
Yeah, so I did not give all the details earlier, but what we're trying to do is maintain essential services. So grocery stores, any stores that provide food, retail in general that provides some of the things that we need for day-to-day life, those are not being closed. Of course, we're going to want them to be very, very careful about the social distancing and wiping down surfaces and avoiding hand contact, all those things. So we tried to be as careful as we could in the listing of things. And the way this is set up is we actually have at the end of the order a listing of non-essential services. And so the things that are not listed as non-essential services or that are not mentioned in the body of the order, those things are allowed to continue, except they still have to very, very carefully follow the recommendations to avoid spread of disease.
And you had a follow-up question?
I do, thank you. Dr. Wilson, we're carrying this news conference live to all of our viewers across the area. Could you stop down and provide a few more of the details that are included in the order to be able to sort of get that information directly to people who might be watching this news conference at this point?
Sure. I'm going to just look at the order here and sort of go through it, okay? The first thing we did is we amended the first part of it where we had a rule of no gatherings more than 25 persons. That is now 10 persons. And any gatherings of any size must maintain that 6-foot distance. We are continuing to say that all senior citizen centers shall remain closed. All schools, preschools are still closed if they have 12 or more children, but there's several caveats with that now. Some of these are in line with the state order that was just issued to make sure that child care is available for those essential employees, and that will be through agreement with those employers. So that would be state and local governments, first responders, law enforcement, hospitals, other caretakers of people who are ill or in long-term facilities, dialysis patients or dialysis clinics, pharmacies, very important, grocers, and financial institutions. So people that work for those types of institutions will have a way now to get child care to support them in their work because their work is essential to keep our community going, to meet our needs, our basic needs. We've also, in our order, allowed for some flexibility for child care, not just of the younger children, but all minors that are children of these essential workers, so that we're not terribly restrictive in those, but we will have to have approval from the health department to make sure the situation is safe for those children. And again, it's going to be very challenging, but those child care centers are going to have to find a way to maintain that 6-foot distance to keep children from spreading disease with one another. Because remember, these are children of those essential workers. So we are trying very hard to support our essential workers and keep them safe and keep their families safe so they can keep doing that work, taking care of us and meeting all of our needs. All nursing home and long-term care facilities, assisted living facilities, specialty care facilities, as before, are still no longer able to have visitors except in extraordinary circumstances such as compassionate situations like end of life. There's one new order that is exactly the same as the one issued by the state health officer and the state today, and that is delaying elective dental and medical procedures until April 6th, at which time a determination will be made about whether to extend that. Again, this is to try to mobilize those resources that we need. In the earlier question, the face masks, the gowns, things like that, we're trying to eliminate non-essential medical procedures and dental procedures so the more critical care can be adequately resourced. As before in my previous order, restaurants, bars, breweries, similar establishments, food establishments will not be able, people will not be allowed to consume food or drink inside of those establishments, but we are continuing to allow delivery of food and drive-through or curbside pickup. And we did make that a little bit more flexible so that people can order takeout and actually go inside the building to pick it up. But again, those facilities will have to come up with a plan to maintain very strict social distancing and very strict care to make sure germs are not spread in that interaction of handing someone food or collecting money. We've continued to exclude hospital food services in that rule as long as they have their own plans, and they do. And let me get to there also is a clause in here just for exemptions that might need to be made. They can be approved by the health officer. So there is a list of non-essential services which is an attachment to this order. And this may be revised over time, so this one is dated today. But the things that are non-essential, in other words, these are things that will remain closed or be closed until further notice. That would be entertainment venues, and there's a list there. Recreation facilities, such as gyms and fitness centers. It also includes swimming pools and spas, excluding licensed physical therapy services. Nail salons and spas, again, these are things excluded. Casinos, concert venues and auditoriums, theaters, museums, parades, body art facilities and tattoo services, tanning salons, massage parlors, waxing salons, performing arts centers, museums, galleries, social clubs, fraternity and sorority meetings and events, proms, formals, and other events. So that's the list that's currently on non-essential. So if it's not mentioned in the body, such as we already have restrictions on nursing homes, on restaurants, on senior centers, we've added to that this list. So if it's not on this list or in the body of the order, then it is not, we are not saying they have to close. But we are saying that everybody everybody has to maintain that social distancing, careful sanitation, and no more than 10 people congregating together in one spot.
Does ABC 3340 have a representative on the line? Have we omitted any callers that may have a question?
AL.com is here.
You may ask your question.
Okay, so my question is, will further restrictions be placed on any restaurants or grocery stores, and how long is this expected to last?
So we do expect this to last for quite a while. There's a lot of uncertainty here. I think we're definitely in for a long, rough ride, several weeks. But none of us can predict exactly how long it will last. A lot of that depends on how well we do in putting in all this effort to curb the spread of this disease. We have seen it turn around in other countries, and we've also seen other countries where it's wreaked quite a bit of devastation. So it's really, a lot of this is up to us and how well we do this. There was a question about restaurants, and, would there be any further restrictions on restaurants and grocery stores? Yeah, so there are currently no restrictions on grocery stores other than the same general rules that we all should be following. And what we're trying to do here is keep the food supply available to the population, including food that's prepared in restaurants. We're just avoiding people congregating inside where they're more likely to spread the virus. I have no plans to change that at this point. There's always the potential of a total restaurant closure, but I don't want to do that because I want to keep people working and helping the rest of us be able to enjoy food and get what we need.
PRC has a follow-up when you have time.
You may ask your question.
Thank you. We have heard some things in our newsroom about the possibility of a curfew. Have you contemplated that Jefferson County is in need of something in place like that?
We have done quite a bit of studying of what other cities and states have done across the United States. There was a great deal of research actually that went into these orders that I did, reviewing what was done in the rest of the country. We also compiled or put together what I would call a think tank of some of our best infectious disease people and epidemiologists in the county. And they helped inform me about how to do this order. I'm very grateful for them. So the question of curfews was actually studied by this group. They looked at what other cities had done, and a few have done it. I don't have any plans to do a curfew. That is actually not the type, that usually comes under the city governments to issue curfews. I don't see that as a step that needs to be taken at this time, but that would not be my decision.
For the last question, it was submitted by Sheila Smoot with Summit Media. What about the indigent care, the medical, dental, etc.? Is the health department open for regular services in West End and downtown?
I'm going to actually bring forward Dr. David Hicks, our Deputy Health Officer, who is over all of our clinical services. Dr. Hicks?
Thank you for the question. So at the Health Department, as many people know, we have the central core public health services as well as clinical services for primary care. And we are scaling back our clinical operations to essential services. We are migrating to performing all of our primary care services and specialty services via telemedicine, telehealth visits. We understand that there may be some of our patients that need face-to-face intervention, and so we actually do have a way to triage and route those patients for that, but we're kind of consolidating our resources. We're trying to preserve our personal protective equipment so we can be able to address the needs of our overall community. And so this is something that we are We're actively looking at addressing, and you're going to see some changes, but we're always going to be there for our patients, and we are not going to abandon our duty to our community.
The public health order will be posted on our website in its entirety. That's jcdh.org. That concludes our news conference, and thank you.